Oh.
All right, hello and welcome to the February, or yes, it is February. Geez, I got scared. The February 4th, 2026 Continuum of Care Board meeting for Seattle-King County. We're gonna get started with doing the roll call.
Yes. Dr. Sam is absent, excused.
Excused, yeah.
Tamara Bauman,
Here.
Jaja Floyd,
Here.
Amaya Lenore. Amaya. Elizabeth Muffin,
Present.
Dorsal Plants,
Here.
Ruby Tuesday Romero,
Here.
Christina Sawicki, I believe is in the attendees. Yes. Victor Liu,
Here.
Amy Thomas. And Devin Conexis.
Sure.
We want to see if we can go back to Amaya.
Yeah.
Amaya,
Present.
thank you, Amaya. You have 9 members present and 1 absent. You've met quorum.
I just want to confirm that 1 absent or 2 absent because we don't have
Well, Martha's on leave.
Dr. Sam and then Amy.
Oh, I'm sorry. Yes,
Amy.
you're correct.
Cool.
Amy and Dr. Sam.
And we'll let the
Thank
record
you.
show if they come in a little after.
Dr.
stuff.
Sam will not.
Okay, perfect. And then I guess the next step would be the approval of the January meeting minutes, and then we can go into the land acknowledgement theory change. Do I hear,
I motion that we approve the January meeting minutes.
oh, Devin, I see your hand.
Yeah, sorry, I just while Martha's on leave, I just wanted to make sure it's noted that I'm attending like on her behalf.
Yes.
Okay, thank you.
Proxy.
Yes.
Thank you. Yeah, thanks for that clarification. And we're happy to have you here. Thanks, Devin. Really quick, yeah, so we're gonna do, so I heard a motion to approve the January meeting minutes done by Jaja. Is there a second?
I, Amaya Lenore, would like to second the motion Jaja made to approve the January meeting minutes.
All right.
And we can approve by voice vote.
Yeah, let's go ahead and do a voice vote. All those in favor of approving the January meeting minutes, come off mute and say aye.
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 Is there any opposed? Not hearing any abstentions? All right, sounds like the motion carries. Now we're gonna go into the land acknowledgement read by Jaja Floyd.
I'm Jaja Floyd. And I'll be reading the land acknowledgement. The King County Continuum of Care Board acknowledges that we work on the unceded traditional lands of the Coast Salish people, especially the first peoples of Seattle, the Duwamish people, the original stewards of the land, past and present. We honor with gratitude the land itself and the Duwamish tribe. This acknowledgement only becomes meaningful when combined with accountable relationships and informed action, and is the first step in honoring the land that we today sit on and their people.
Thank you so much. Appreciate that, Jaja. And I believe Victor was gonna read the theory of change.
Yes, good afternoon, everyone. My name is Victor Liu. For this work context, I use he, him, his pronouns, also the CoC board member. Theory of change. If we create a homelessness response system that centers people who have lived experience of homelessness, then we will be able to meet needs and eliminate inequities in order to end homelessness for all.
Great. Thank you for that, Victor. I appreciate that. And I just wanted to make sure we, took a moment just to honor peace here in this time. And so the next thing on our agenda is going to go to Dr. Kelly for the KCRHA CEO update, and I believe she's here. Oh, and I've also wanted to let the record show, thanks Kelsey, that Amy has joined. Hi, Amy.
Thank
But,
you.
Yep, there you go. Hey, Kelly.
Thank you, Chair Romero. Hello, Chair Plants and other board members. Lovely to see you and KCRHA staff together. For this quarter, I wanted to just say thank you for the collaboration that we've already had this year on of course, our point in time count and many other activities related to our federal funding. I'd like to share with you our our agency goals for 2026, and just give you a look at how we're talking to our partners and our new executive, our new mayor, other new elected officials about KCRHA and what we hope to achieve together this year. So first, we are really focused on stabilizing our current system. That means strengthening the coordination, especially across the region, and homelessness services for everyone in our region by really measurably improving the situation for unsheltered homelessness. That means stabilizing our system, making sure that we do not lose any of our 8,000 permanent supportive housing units because of the change in federal funding. It also means navigating the way that just the impact of that process has changed how funders are thinking about supporting those permanent supportive housing units and our communities in general. So having that decision support analysis for them, getting your feedback and concerns, and making sure that that's part of our landscape analysis as we go about figuring out what our new normal may look like, especially after this round of our 2025 CoC funding. We have 6,000 emergency shelter beds. As you know, we have to maintain every one of those. And we're also looking at effective models for bringing more shelter online. We know that we have too many people sleeping outside every night. We know that our elected officials have expressed their commitment to speeding up the process to siting new shelter and potentially providing funding for new shelter beds. And so we've really been working behind the scenes really since last year to look at the information we have about some of the initiatives we've done, especially our right-of-way or encampment resolution program funded through Commerce, to think about how we might really have meaningful impact on those that our system does not currently serve well. We're looking at other models of shelter, including non-congregate shelter, tiny house villages, micro-modular shelter, using existing buildings. There's no new magic thing that's going to help. It's really just a coordinated, focused, honest effort to bring coordination and improvements to our system step by step and in sync across the region. We've also really focused our team this year on system accountability and coordination. So really getting more in tune with policy shifts across the region and positioning ourselves as a place where elected officials can come when they're contemplating policy changes and just get research and data and maybe the expertise and advice from our boards and our other partners as they're considering changes to how they address homelessness in their communities. Also thinking about how we find access to land or sites for additional shelter and what that looks like across the region. We have elected officials who have really stepped up and made public lands available, and others where we have more work to do. We're also just thinking about the system-wide perspective, so how we build lasting relationships with people who are unsheltered and try to renew their faith in the system, have that process, everything from outreach to sort of a day center, access to resources, to shelter, and then to permanent housing in each part of our region. And that takes, again, a lot of coordination and a lot of accountability for what's happening in each of our communities. We made a lot of progress in 2025 on data, and we're very excited to now have a lot of new tools that are ready to deploy. Again, thanks to much of your board and committee's work.
I have glasses to pick up for Amy.
And
Comments?
we are looking at services across the region, again, trying to make sure that folks have access to that continuum of unsheltered homelessness response system services, no matter where you are in King County. We have new mapping of capacity to look at that we're nearly ready to launch. We have the regional services database that we're renewing and refreshing so that we can really take a deep dive into different geographies in our region. And really thinking about how we budget differently for our region. So that's a key area where we want to partner with Mayor Wilson and Executive Zahalai to talk about how KCRHA's view of the region can really inform the resources that we need to plan for in our system, and that we have our CoC board and other partners who have a really good sense of the gaps and the missed connections where we need to, without large influxes of resources, we can still do better, and we should understand where those missed connections are and strengthen those. And finally, just some new reporting that some of you all have been asking for, dashboards and other data available on demand, as well as our governing board has wanted some different reporting. So just trying to make everything we do useful and more customer driven. We know that we have a new 5-year plan addendum that's hopefully going to be approved by our board. And so we want to be able to communicate our progress against those new or refreshed goals, and really work with you all to understand how we should be measuring our progress and what KCRHA should be measured against. So again, I really want to thank you. You've been essential to the progress that we made last year. We'll keep you all informed as we flesh out these strategic goals and get them approved by our governing board. And really looking for ways, the co-chairs and I have already talked about ways to try to get our new elected officials kind of connected into the CoC's work. Make sure that they're getting information about what you all are doing and that you have the opportunity to advise them. And we have a retreat that we're planning where we're excited to have co-chairs present on the work for 2026. Not scheduled yet, but we're working on it. And just really looking for ways, having everyone in the room and talking about ways that we can bring these two boards together, which I know has been a priority. So that brings us current in terms of how we are thinking about the year. Again, a lot to be discovered as our new officials kind of roll out their specific homelessness policy priorities, but we know more shelter is high on that list, and we've been doing that prep work. We know that knowing how many shelter beds we have and we need is one of the really compelling stories that we're able to tell that moves folks to action. And that's where our point in time count is so important. We thank you for all the planning and effort that you've put in. We have so many community partners volunteering. We also know this is a highly imperfect process. As it is in every community that does it. It's a huge undertaking that's massively underfunded. If you compare it to, kind of what folks charge to do these kinds of data collections if you're in the private sector. So we really look forward to debriefs that we are already planning to get your feedback and keep making it a stronger effort every year. I know Kelsey has a formal update for you on the federal funding moment by moment this week. So I will turn it back to the co-chairs and the board for any other questions.
Thank you, Kelly. That was a great update. Glad to hear a lot of the things we've been working on for a while are kind of coming together. Sounds great. I just wanted to make sure, turn it over to any board members that had any questions. No, it was a pretty thorough update. Oh, I see one, Dorsal.
Can't let you off that easily, Kelly.
Hi, Dorsal.
Hello. Thank you again for your time. I was just kind of curious, and I'm mostly only monitoring it via the news, but I know Mayor Wilson seemed really eager on the conversion of, you know, I don't want to use the word abandoned, but buildings that aren't being used very well. I guess, have you heard or gotten a sense like, I think that's a really strong approach in Seattle, but I was curious, like, have you all looked yet at like how like viable that is countywide with some of like the smaller city, like is it, I guess, is the abandoned building approach more going to be focused in kind of like the Seattle like urban center proper areas, or is there a possibility to look kind of in more of the rural areas for kind of these sites too?
Such a great question. My sense is that kind of all options are still on the table. I think that, it makes a lot of sense to any of us to hear, hey, there's apartments that aren't being rented, that are sitting empty, that landlords can't rent, that, the builder can't sell the building. And then we've got folks sleeping outside. And so why would we not find a way to use those apartments? I think that can work for some folks. I think there are barriers that they're working through to figure out how you would, do that with landlord tenant requirements and other things, how you would provide services for folks who are kind of, potentially scattered across buildings. And I know that they're also looking at whether some shelters or current operators have more availability, like more space for beds that aren't online because they don't have the funding for them. That also seems like a really obvious thing that we might do is, go make sure every available bed is truly available and online, because there's adequate funding. Again, there are challenges to that. Sometimes they've been taken offline because it's not in an area that is conducive, right, to healthy living. It's not where people want to be. It's, the building is just not working anymore, things like that. But I've been really impressed by the openness to ideas and the engagement directly with, KCRHA staff and with providers to get their thoughts about how we do this quickly. And I appreciate the executive order as well about cutting the red tape, permitting, and just the layers of process that things have to go through. And that in an emergency like unsheltered homelessness, how can we streamline that as much as possible while still sort of keeping folks safe?
I thought a follow-up to that question in the chat, was there, I think it was from Elizabeth about commercial spaces. If that was a thought, but it sounds like you maybe said anything was on the table. So maybe there's any insight on the commercial spaces that you have?
So I've heard less about commercial spaces. Again, I think it's one of those like, of course, if you've got empty space, how can we put folks in them who need to be inside? And the sort of regulatory environment and like those buildings are often made, with like large communal bathrooms, for example. And so turning that into something that's, non-congregate and is going to be really a healing space for folks and what they're looking for. I think folks, are a little bit more leery of having that work in a way that's like cost effective versus, buying and converting a building that was more single occupancy, like a hotel or a care facility or something like that, apartment buildings. So I've heard a little bit less about the commercial. But again, I really think these folks are not taking anything off the table. And I think that's a really good approach. We've got to start doing things differently if we want to get different results.
Yeah, that's great. Great answer to a great question. Jaja, did you have one?
Yes, thank you, Dr. Kinnison. I was wondering, I've been wondering this for a long time. It's health through housing, right? How we bought all those hotels. Is KCRHA in line with them? I mean, is it siloed? Are you guys talking, connected? Because I know there's they bought the hotels, right? And I know it had something to do with jurisdiction as far as the city it's in and the pushback. is happening, but I mean, how can we get past that? And have we thought about how we can get past that in order to utilize those things we've already purchased and people are outside, they can be in there? You know what I mean?
Yeah.
I do. And it's another just really great question. I think, the county, it seems, got better at identifying and negotiating, buying those properties as time went on. And as we know, I think one of the first ones came online recently, and there was a lot of coverage of like, was it a good investment? Did it cost too much? Did they pay too much? And all of that. And I think my sense is that the county was able to get much better at that during the time that they were procuring those buildings. And then we run up against, what we run up against everywhere, which is, different kinds of resistance in different communities.
Mhm.
And that's not something, any one of us can solve alone. I think it's getting our messaging really clear, making sure those operations are run really well, making sure the tenants, the clients are really well supported there, and just doing some educating. We've seen with other models that once it goes in, if it's operating well, we're always talking about groups of human beings, which are imperfect always. But people say, "Oh, this is great. I like having these neighbors, and I want to volunteer, and I want to have this resource in my community." And I think we need to get faster at that, and I think maybe a little more proactive about that. And I think also having our politicians being willing to um, uh, face more of that public scrutiny and sort of have a clear way that they're deciding whether a community's, is it the community pushing back, or is it businesses? Is it, a few? Is it many? And sometimes that's a little bit opaque. And so I know we've had conversations with our city partners about that. And I'm sure the county's having similar conversations about how do we make all of that more transparent.
Thank you so very much.
Is there any other questions for Kelly? Victor?
And Elizabeth.
Kelly, it's good to see you, but
Hi,
thank you for
Victor.
being here. I do have a question. It's not around a fiscal question. I'm curious about whether KCRHA operating budget for year 2026 has been approved and finalized, because I learned that there was recent delay due to not having quorum to vote on it. If it has already been approved, I'm just curious about the impacts compared to year 2025.
Yep, thank you for that. Our budget is not approved by our board, but it was approved by our funders. So, as you know, that's the city of Seattle, King County, and Commerce, and we're still waiting about federal funding. But we know that the bulk of our budget is set. Our board needs to approve that as sort of an administrative process, but at this point, it's not holding up, for example, renewing our contracts, and we expect, 2026 invoices to start coming in. So we do anticipate that they will take action on that this month at our February 20th board meeting, and that won't, we shouldn't incur any operational delays if that's the case. Everyone knows that situation, and that, we had tried to get it approved in December and didn't have quorum, and then didn't have quorum for a January meeting, likely just because of, all of the board members changing over, not just our mayor and executive, but the council, Sound Cities, Seattle Council, King County Council, and Sound Cities also renewed their membership on all of their committees, including our board. Just too many new board members in too short of notice. So we expect things to get back on track in February with that. Relative to 2025, we're about flat. There's probably some minor differences that I have not memorized, but someone in the room with you all, I don't know if, I know Jeff's there, I don't know if Tiffany's there. can get back to you on that exact level, but we're basically flat for 2026.
It looks like we have one final question from Elizabeth.
Yes, in terms of community pushback, have you done any research on what is most effective in dealing with that? And have you been in communication with the Ballard Community Task Force on Homelessness and Hunger about their changing the narrative presentation that could be helpful in some communities in engaging people in a conversation and dealing with some of the pushback, helping people to see homelessness from different eyes?
I am in touch with the Ballard group. I've only made it there once, but I'm due back again in a couple of weeks. And so we'll absolutely follow up with that group, who I think is doing really great work, to get the presentation, because it sounds like something that can be really useful. We have a group that's meeting provider comms folks and our communications folks, to kind of align messaging. So, you might, in some groups you follow or that you're involved in, sometimes there's a theme or something that just makes an amplified voice. And so we are thinking about taking that approach in 2026. So, we'll choose a theme and then try to get as many providers, partners, and others to really, post on their social media, do blogs, do interviews, do media around that topic or issue or sort of perspective on unsheltered homelessness, so that, our community is driving that versus waiting to see, whatever Seattle Times might cover, or what might come into the news as sort of a negative controversy. Really trying to push forward our success stories and then explain the sometimes really complicated way our system works, in a way that's consistent across our partners and understandable to the folks who are concerned about what's going on in their neighborhood and want a voice in what solutions their neighborhoods put forward. So yeah, I think hearing more from community groups that are already doing that work. KCRHA is a place where we want to amplify that. We don't need to recreate it. So we'd love to amplify that messaging when it fits with what we're able to do as a public agency. And all of us, we've been, as short-staffed after our end of 2025 layoffs, but are expecting some team members after our point-in-time count is finished to be able to sort of be out in some of the groups that are doing that work and bringing that messaging back and doing some of that coordination as well.
Thank you.
Yeah, thank you, Kelly. That's very, very great round of questioning there too as well. And I thank you so much for coming to share where you guys are at and working towards a better system. Sounds like we've got great plans with aligning messaging. It's important. So thank you so much again for coming today and giving us your update. We look forward to seeing you soon in the future.
Thank you. Yeah, I think we have a meeting soon. So I will see the rest of you at our next check-in.
Thank you, Kelly.
Thank you.
Bye.
Bye. All right, now that we've heard from the CEO of KCRHA, I believe the next thing is the public comment section. And just wanted to open the floor for anybody that is here. If you could raise your hands in the Zoom call, right? We're on Zoom. Okay. I'm sorry, there's too many video. Yeah, but anybody here to make a statement could raise their hand now. That would be your time. And just checking that we didn't get any submitted.
No,
Right?
we did not.
Cool, thank you. Don't see anyone popping up.
No, Kelsey is running this.
All right, well, this is a second call for public comment. And a third call for public comment. Not seeing any hands or hearing any. I'll just remind everyone that they can always send in public comments to the coc.questions@kcrha.org. Great, so that wraps up the public comment portion. moving right along into the board and committee updates. I believe the first one we have is Ms. Jaja Floyd right here.
Oh,
The
hi.
coordinated entry update.
I'm the coordinated entry update summary. We had we had a very robust meeting about the assessment pilot. And the assessment pilot work group reviewed the first draft, phase 1 of the new triage assessment tool. And we have our wonderful liaison, Tom, right here. If I make any mistakes, he'll help me out here. For the community pilot team, we also, the work group had expanded to include the technical assistant partners, which is the UW Informational School, to support for evaluations. The revisions were underway. No firm timelines have been set pending clarity of the scope of changes. The proposal will be returned to the board for review. And once their final draft and implementation approach is ready. We did the coordinated entry operations. We did the coordinated entry. We re-engaged providers through reconvened subpopulation leadership teams. We had a consistent provider feedback, raised concern about a daily unit posting and nomination cadence, citing inefficiency and reduced matching qualities. We had discussions about ongoing challenges, including adequately prioritizing medical and behavioral health acuity. We wanted to improve the alignment between needs and housing interventions and strengthen case management and cross-system collaborations. The board members highlighted the need to better address immigrants and refugee homelessness and deepen partnerships with health systems. I want to say that in that meeting, Tom was absolutely fabulous in the sense that Tom did like a call out to everyone in the room to get into their own networks and bring everybody to the table, because the coordinated entry system alone can't do it. And we need the help of others. And I really felt that was, that impacted me in a very positive way, because it kept everything out of the silo. And if we all work together, then we won't duplicate and will also be a more effective coordinated entry system. But we can't do it alone, and we need to know what's going on out there, and we need the information. So we need folks to collaborate with us. And that's what we did. How's that?
It's great.
Great.
Back to you, Ruby.
Cool. Well, it sounds like you guys are doing great work there. I'm loving that. And does anybody have any questions for coordinated entry? Not hearing any, I do. Or, I'm sorry, Elizabeth, there you go.
Yeah, I just wanted to ask, what's your experience with coordinated entry out in the easternmost part of the county, out in Fall City, North Bend, Snoqualmie areas? What I'm hearing from people out there is there's no shelter, there's nothing. They're feeling kind of, they don't know how to get into any kind of system.
Yeah.
Yeah, Elizabeth, thank you so much. That's a great question. There's hold on. There's a partner, community partner, someone who, Amber Toller is her name. She used to work with the Low Income Housing Institute here, you know, kind of based more in the central Seattle, you know, core main King County region, but has recently, this year left and, went to go work for a provider in the Snoqualmie Valley area. And so I had a meeting with her recently talking about coordinated entry, actually I'm glad you asked about that, because I recently met with her to talk about, I'm trying to, if I had another minute, I don't want to make people like wait. I want to remember like what the name of their organization is, like Reclaim Snoqualmie or something like that, or Uplift Snoqualmie. And just talking about exactly this, there are community access points to coordinated entry in the eastern part of King County. Organizations like Amber's do have coordinated entry assessors that could do assessments for folks to be able to access the system. The problem is that there aren't many resources out there. Most of the people that she was telling me that they work with are people who'd like to stay where they're from. They're not as interested in moving to permanent supportive housing projects or transitional housing projects in the western part of the county. They'd like to stay. Most of the folks who are experiencing homelessness there are from the Snoqualmie Valley and would prefer to stay in that area. There just aren't as many resources for them. So we had a great conversation about access to coordinated entry in the eastern part of the county, as well as kind of, some forward thinking and some good things that are not only challenges for just, us with the coordinated entry system and team to kind of be thinking about and addressing, but also, kind of going back to what Dr. Kinnison was saying and things, for our kind of not only our programs department and procurement department, and planning, but our partners, at King County as well, to talk about planning for how to promote and develop more investment and infrastructure for actual programs in the eastern part of the county, so that even when there is access for folks out there, that they have options so that they can, receive benefits kind of like where they're actually wanting to live. So thank you for that question. It's a good one. Yeah.
They definitely want to stay in the valley.
I saw her head shaking vigorously yet. I'm gonna say that. Dorothy, you have a question?
I just wanted to reinforce Elizabeth's point and also give South King County a shout out. About a month or two ago at the Renton Planning Commission, there was some testimony that was provided to the Planning Commission at the City of Renton that South King County residents, City of Renton residents have not been able to access coordinated entry, that it requires traveling to downtown Seattle in order. And I don't feel that that's aligned with my previous experience with coordinated entry, having served previously as an assessor, but kind of like same thing with like Elizabeth saying is like, I know you all are doing great work, but there might be like a gap somewhere in like sharing it the further you get out from Seattle, if that makes sense.
Yeah, Dorsal, thanks for saying that. One of the reasons why I'm so happy to, like Ruby and I were volunteering together last week for the point in time count, and such a great experience for me to be at some of those hub sites and watch other volunteers go through the interview script with folks, and then also kind of start to have conversations about housing opportunities and coordinated entry, and great kind of like information and data gathering for me and like my position to see how tough it can be for folks to try and explain what coordinated entry is and how to gain access to it in a very simple, straightforward way. And so I think that's a huge area of initiative for my team this year, is like working on our work plan this morning. And one of our goals is, for lack of better terms, like kind of like PR and marketing, and just kind of like communications, like this is what this is in kind of like the easiest, most digestible kind of forms, and like really letting people know, like, here's where you can go to get an assessment. Because I think that is typically where the breakdown is that we have two, as you were saying, access points kind of in more southern Seattle area with multi-service center and Federal Way, and then also south, like another one, it's not coming to my mind right now, sorry, I'm brain cramping, but there are more access points, just not just in like the downtown Seattle core, but kind of like having some better and more clear communication about and for me personally, I think it's very important for us in coordinated entry to not only talk about how to gain access to the system, but also what we provide and what we don't provide.
Yeah.
Because I also think too that there's a lot of misconceptions about, like, I could tell you from being a specialist on my team, hosting office hours, all the community care providers that will come to a drop-in office hour with us and say, I was hired last week. My onboarding was, my supervisor told me your job is to help people find housing, and how you do that is coordinated entry. And that is such a woeful kind of like underselling of kind of really what can go into explaining folks like what their options are, and like what their options are through the CE system versus maybe like low income tax credit housing, gaining access to KCHA or SHA wait lists, et cetera. So there's a lot there. And we're thinking all that stuff's on the table for us to talk about, to better communicate, so it's a little bit more clear for folks.
This is Christina, and I'm not able to talk very well, but is there ever an option for tele or virtual coordinated entry for like some places that might be even remote?
Yep. Yeah, there's the regional access points do phone assessments. So you can call on our website. You have the list of regional access points themselves, and then also their like drop-in and like their phone information, their addresses, the like drop-in hours information. And if you were to call any of those regional access points, you can talk to folks about, hey, I'm not able to make it there in person, but can we do an assessment over the phone? And that should be an option that's available to you. And if it's not, I would love to hear from you to let me know if that's something that they're not offering, because they should be. So
Yeah,
thank you for that, Christina.
I'll confirm that I've gone through the phone assessment process with some people before, and they do call back. They call back, so.
Nice, okay.
That's an important thing to me, is when you make a phone call, it's important to get a call back, at least to just tell you that we can't help you would be nice.
Right,
You know?
yeah.
Right.
And so I really appreciate the work that coordinated entry's been doing. Clear messaging, man, that's like the theme of today. I'm loving it. I can't
Yeah.
even. Anyway, that's exciting. Is there anything else for a coordinated entry?
No, I just want to say that being on the co-chair of the Coordinated Entry Committee is an opportunity and a joy, because I get to see things lived out in real time, and the understanding of what it is, because I went in not knowing, and now I understand better what it is and what it isn't, right? And I think that if partners would come together with the Coordinated Entry System, then they too can figure out what the limitations are so that the gaps can be filled in. And I think that's really important, because I came in thinking that the Coordinated Entry System was a place where everybody got housing. If you need housing, go get in the Coordinated Entry System and wait to get to the top of the list.
Yeah.
Right? And that's not how it works, right? That's, if you want Section 8, that's the kind of thing, you know what I'm saying? So there's different people who are doing different things, but people are thinking that the coordinated entry is the umbrella for all those things, and they're not.
Yeah.
And that's what I found out. So I just want folks to be clear that I'm learning and we're being transparent.
Yeah, it's great. Engaging with things can really help you like understand them fully, you know?
Right.
Great. Just moving on, I know that Christina can't do an update for the SPC or System Performance Committee right now, but I wanted, unless she can, I don't want to put words in her mouth, but
It's very hard for me to talk.
that's what I thought. I just wanted to make sure I got that confirmation. Thanks, Christina. So just in light of that, we were gonna offer that the meeting minutes and the recording are up on the KCRHA website for System Performance Committee underneath the January 19th, if I remember correctly. I'm so sorry. January 19th meeting, the January meeting. And it's got all the information that you need there. And we can give a better update at our next meeting. Moving along, I do see an update for the YAB is listed. Is that Amaya?
No,
No, I'm sorry.
Yeah.
there isn't.
Oh,
I was going to provide a little bit of an update. So right now we are working on kind of strengthening the foundational materials for the YAB. Catherine has been doing a lot of work outreaching the members who are a part of that. There has been kind of a shift in participation, so we are working to kind of reignite things and aiming to get some recruitment going in the next month or so.
Thanks for that, Kelsey. Sorry about that. I didn't have your name listed. My apologies. Now dorsal. It's all you for the co-chair update.
It should be relatively quick. We are still having the co-chair meetings on Monday. The next one will be this coming Monday at 3 o'clock. We put the agenda together because you saw the agenda for the meeting today, hopefully. I think there's a lot that's been going on that is a lot of what the Army would refer to as hurry up and wait. So we need to do this quickly, but then we need to wait weeks or honestly a month or two to figure things out. There's been a lot of movement between the NOFO recruitment process, not one, but two severe weather events within the last 90 days. The pit count ongoing. There's a lot going on, but stuff is still happening. There will be an update from the selection committee as far as the recruitment process goes. The invitation should have gone out for the next virtual convening. As Dr. Kinnison, or as Kelly mentioned in her briefing this morning, there will be opportunities after the pit count is complete. You can't do after action until after the action. It's in the name. Thank you all to the dedicated people who are finishing up the last few miles on the pit count. We'll have an opportunity as a group to work to improve that product moving forward into the future. I think that's everything, unless Ruby, you had something that you wanted to add?
No, just that this is my first time volunteering at the pit count, and I've really had a lot of fun. It's been a really good experience. It's been fun trying to iron out some of the wrinkles as it is with anything. And I just wanted to say, thank you to all the volunteers that have been working with us and all the hub leads and all the staff that have been really stretched like probably a mile too thin, maybe sometimes, and then at other times it feels like
Right.
we're all just chatting. And I love that community vibe that kind of comes with working with our clients and trying to get a better understanding of our system. And it's been a really fulfilling experience. So thank you guys. But that was my only update on that. Now, I think, is there any other questions on any of these updates, making sure I'm not glazing over anyone? Okay, perfect. Handing it back over to Kelsey for an update for the KCRHA general update, which is a new addition to the agenda, I believe.
Yep, so this is probably quicker than we have time allotted for, but wanted to provide a couple of general updates of things that are happening at KCRHA. As of today, we have 81% of all 2026 contracts completed and executed. This is a significant increase from the past few years and really a testament of the shift in the system from Flux to Salesforce, as well as all of the work that not only every single provider has put in, but the kind of entire workflow within KCRHA. This is a really significant milestone that really just wanted to highlight. We also have comprehensive monitoring that is kicking off this month for CoC programs. As projects complete their performance period, monitoring will begin. So we're doing this on a rolling basis. So the projects that will be monitored over the next month and a half or so include DESC Green Lake, which is a permanent supportive housing program, some rapid rehousing programs, the DVSA rapid rehousing program, as well as the regional DV consolidated project will also be monitored. We have Home at Last, which is a youth PSH project, a joint component rapid rehousing transitional housing program run by the Salvation Army, Hickman House, Kerner Scott House, a safe haven operated by DESC, And then the multicultural integrated support team, PSH, run by Open Doors, will also be monitored in the next couple of months. Those are kind of some internal things that are happening, and we'll pause if there's any questions.
Elizabeth?
Yeah, I asked in the chat, what does the monitoring consist of, and what aspects are you assessing in doing this monitoring?
So monitoring is looking at both fiscal, programmatic, and policies. So fiscal processes, invoicing, internal controls are reviewed. Client program files are reviewed to ensure accuracy of documentation, particularly around eligibility documentation. And then required policies that are listed by both within the contracts with KCRHA as well as fund sources are also reviewed to ensure that programs and organizations have those policies and are following those policies.
Thank you.
Or did you have?
I do have one thing, but not on.
Okay, Torso, go ahead.
Kelsey, does this program monitoring include physical site visits by KCRHA staff, or is it just like remote kind of document reviewing?
It's initially remote document viewing. Should there be findings or other recommendations, there may be a site visit. That depends upon how the initial documentation review goes.
May I ask why a site visit would only occur? Like, is there a different pattern to do site visits, or does KCRHA only do site visits if there is an identified issue?
Well, we try and ensure that a site visit is done by all programs throughout a period of time. I think the largest piece is capacity to do so in a one period. This is the first time we're doing rolling monitoring. It's usually done at one period of time of a third of all projects, which is a fair amount to be monitoring all at once. I am outside of some of the monitoring processes, so can't speak fully to why those decisions come about the way they are. But I do know that the decision to first start with the desk review, which is the kind of documentation review, and then determine whether or not a site visit happened, was really led by the volume and available staff.
Thank you.
May I do that?
Yeah.
It might be useful, so it would be inappropriate to use the term audit, but a lot of
people. Can you introduce yourself? I'm sorry. Thank you.
Jeff Sims, I'm the Chief Program Officer at KCRHA. So when we say comprehensive monitoring, a lot of people they think of it as being an audit. That's not actually what it is, but it gives you a sense or a flavor that there's our recurrent monitoring that someone at KCRHA that is one of our program leads is doing every day, maybe meeting monthly, sometimes bi-weekly, depending on what's going on with an agency. There might be site visits to go along with that. For the most part, we would expect that they've been to, maybe not every site. There's a lot of sites that they have to go to, but over the course of time, they've probably been to them all. And then on top of it, as another part of our overall work as a grant-making agency, is this process where we really get in depth. And so it's a staggered kind of tier where it's like you do your file, your document uploading to us. We do desk reviews, all the things that Kelsey talked about that really get into depth. And then for those that are kind of triggering a threshold of concern, that's what moves to, we're gonna now go on site and do it further. So it's not that the site visits are only happening because of this. That is the further along, and then there are reports of potential findings or recommendations that arise from this. So this is the much more in-depth process on top of all the other things that we're doing in front.
I have a follow-up to that question. Sorry, really quick. Just wondering if could you share that if we look into ombuds reports at all, taking that into consideration at all, if there's any reporting, just thinking about, maybe just a suggestion, or maybe we could take it offline or whatever, but that was just a thought I had.
The ombuds process proceeds separately, so that they will, let's say that there's something that's been communicated as a concern or a whistleblower or something like that. They will on their own and separately as a kind of as a quasi-independent approach,
Mhm.
will look into that and come about. And frequently there'll be some kind, I mean, the vast majority, we've gotten reports in the ombuds, so the vast majority of what they get is like information,
Mhm.
right? That's an information request. But in the case where they are doing in like I'll use the term investigation. I don't know if that's the term that they would use.
Mhm.
They would, result in a report about that, things along those lines.
And then
it's
you
separate.
would get that, okay.
Yeah, the programs team also gets that.
Ah,
So a lot of
okay.
times they might have, like, so imagine that I've got a contract lead in one part of the department and the ombuds like has done this review and they find actually like this flyer is causing people harm
Mhm.
or confusion.
Mhm.
Could you fix it? Like we can take care of that immediately by like the person that's routinely meeting with them, say, hey, like,
Mhm.
let's correct this right now. Like, there's
Right.
no need to go through staggered once every 3-year processes for that. We can do it much more rapidly.
Right. Great to hear that communication is going though.
This is Christine, a point of order. Captioning said death reviews as in dead people.
Desk, DES.
K.
Yeah, K.
DESK.
Hopefully that cleared it up.
Thanks, I got worried.
No worries. Appreciate that. Dorsal, I see your hand. Oh,
I wanted to add one piece, but after
Okay.
Dorsal's line is done.
yeah. Dorsal, did you have a question?
I did. I also wanted to uplift Elizabeth's question in the chat too, just because I'm not hearing it's that there are no site visits, just like usage of volunteers, because I like the site visit piece. The question I have is, and nobody wants to go down that route, and I'm not suggesting that it is a route that has been or will be taken, but I guess where does this like monitoring report ultimately end up after like a certain point where there hasn't been a correction? Like, is there an annual report that Kelly and the governing board reviews? Is this an entirely internal program element? Like, when you have these issues and are like working with like obviously if you're working well with a partner, that's a very different situation. But like, I guess, where does this information ultimately end up going, especially in the case that it's not corrected?
To Elizabeth's question, sorry, Jeff Sims, Chief Program Officer again. To Elizabeth's question, no, this cannot be done by volunteers. This is a fundamental process that every governmental entity in the country does. It is a routine approach. The standards that we've talked about, like what you're looking at, the degree that you're looking at, it is being compared against regulatory requirements, fiscal requirements, accounting principles, things like that. So this is a standard process and approach that every governmental entity in the country that is a contracting or grant-making agency goes through. And then we are fulfilling that function because that's really fundamentally what KCRHA is doing, is making grants. So that's what we're doing there. And a part of that normal course of business is that we then put together the report that goes to the agency that was being looked at with their findings and their recommendations. So you will hear, like KCRHA's had it happen too. Like we had a finding with HUD or a recommendation from HUD. So this is at all levels something that occurs. And then the expectation is you close those out and address those. So, like as that has occurred for KCRHA, we diligently turn our attention to what do we need to revise, change, or improve in our process to make sure that gets closed out, and our agencies do the same.
Yeah. My understanding is the communication between organizations and their funders this is kind of how that all comes together. So like, this is like HUD reporting and also like all of the increments, right? Yeah.
Exactly.
Okay,
Yeah.
Thanks. Because I'm sure you send different. Oh, hi, Christina, go ahead.
This is Christine. How do we get input into how our neighbors feel about these programs? Like, how do we know what people like me are saying about it? Because that's one piece I've noticed that our CoC doesn't do as well as watching some of these other CoCs is we know, I'm going to pick on, the Apple Foundation. We got 5 complaints, or we're hearing from the consumers at that foundation. You know what I mean? That this is how it is, or this is what they need, or that kind of thing. How are we finding out as board members how people are doing or feeling about these programs, like consumer feedback, client feedback, something like that?
Yeah.
So I want to be
board members, as board members, I think it's important to speak to our community and bring these to the, encourage our community to go to the ombuds office, which I think is the best option for specific encounters with organizations or just a collective experience that people are experiencing. But yeah, I think that's kind of the best way. And then the ombuds report is yearly. As far as I know, they have an annual report that they put out that kind of goes more in depth into the trends that they saw while not identifying anybody that has made those statements or tickets, if you will. But I think that talking with our community and bringing those forward to the ombuds office or to the organizations themselves is an important way to do it. I think that is the best channel though, right?
That's definitely the best channel.
Okay. Is there any other channels?
I think that, I mean, again, like, think about the things I just listed as what we're looking at, regulatory requirements, accounting principles. That's not a like neighbors input kind of a thing. So the ombuds is a much more direct pathway there. If you want to identify a concern with how our program is operating or services there, things like that, that's why we have that office. I believe, did we establish we're the only COC with an ombuds office in the country?
I can't remember.
Yes.
Yes,
Wow,
I believe we are.
that's great to hear. Well, and I think we need to use it then, right? So that's helpful. All right, I just want to make sure that we're staying on track with this conversation.
Can I add my point?
Oh, Jeff, sorry.
So
Jeff
on
had
the-
one more point to add. Yeah.
So going back to the first thing that Kelsey said on the 81%.
Yes,
I want you to know that is actually a bad number.
that is.
It's
Okay.
not a good number because we're actually closer to 95%. So when you add in, we have 26 contracts that are not completed there. They have been fully drafted and sent out to an agency for them to sign. That takes us, and then there is a small number of contracts in there that something very unique is happening with them. Some of them are new. So it's like something we just are starting in January 1 of this year and it needs to be formulated, or there's a couple examples where there is an agency that had 2 contracts all working in the same place and we are working with them to consolidate that. So when you take out those little like few and then the 26 that are out for contracts, we're actually like nearly 100% done. So that's the number I think that we should walk away with. It's not 81%. And my team is moving on to comprehensive monitoring for the most part. So.
We got glass half empty, glass half full, glass is just full of something, right? So that's good. No, I like that. There's different ways of looking at things. Kelsey, I'm gonna.
Kelsey, you can't use it real time.
No, I was gonna, oh, there she goes. While she's changing that.
Right, you can change that in real time.
Yeah, while she's changing that, making sure that stays, up to Jeff's, standards there. Amazing how we can do so well in just a minute there.
I know.
Yeah, that's
15% improvement like that.
Just like that, just like that. We're gonna hand it back over to Kelsey for,
Oh, we can do a break.
well, we're gonna do a break, but she probably wants to finish her presentation
Oh, I'm
first.
sorry.
Yeah, it's okay.
That for just general updates, that's all we have.
Oh, great. Wow. Jaja was right on cue there. So it's 3:03. We're gonna take a little bit of a break and come right back at 3:08.
Okay.
Is 5 minutes?
Yeah.
And we'll see you guys shortly. It is 3:08.
That's right.
If people could maybe come off of their camera, come onto their cameras to let us know that you're here. So we can get started again. Thank you for the quick break. Bada bing, bada boom. Quick, all right, I think I see a good amount of our board back. So while we're slowly getting started, so we can allow for the other co-chair to come onto their camera, know they're here, so he doesn't miss the joke. All right, well, so we're gonna go ahead and get started. Kelsey again is gonna give the update for the NOFO. And so I'm gonna hand it over to Kelsey, the NOFO Slayer.
The NOFO Slayer.
That was a good joke, right, Kelsey? I thought it was a good one. You're on mute if you're speaking.
Yep, I was getting stuff up. Hello again, Kelsey Beckmeyer, she, her pronouns, CoC manager with KCRHA. So wanted to share updates on both the FY 24-25 NOFO and some other pieces HUD related. So January 9th, HUD reopened the 24-25 CoC NOFO that was published in 2024. HUD clarified with the opening of this NOFO that CoCs renewing FY 24 awards did not need to submit additional materials. And any additional submissions were only required in certain circumstances. If there were awards that were renewals but not eligible to renew in FY 24, meaning they did not expire in the 25 calendar year and were not in the FY 24 renewal, if we needed to submit those, we would have to submit a priority list. If we were reallocating any dollars and changing award amounts to any projects or creating any new projects with reallocated funds, then we would also need to submit a priority list. None of those circumstances were the case for our CoC WA 500. So no project applications were required, no priority listing was required. The only guidance that we needed to take or information we needed to take where CoCs, collaborative applicants were informed that they may tell HUD earlier than December 9th of our intent to renew all of our awards that were awarded in fiscal year 24. That guidance was provided on January 26th. So CEO Kinnison informed HUD of KCRHA's intent to renew all 52 grants and the CoC planning grant on January 30th. We wanted to do this before a government shutdown. The government was shut down for a few days. Luckily, they are back and functioning, but no other information or materials are or will be required for fiscal year 24 or 25 awards. A few things that are to come. So the THUD appropriations, this is the Department of Transportation and the Department of Housing and Urban Development. That appropriations bill was passed and signed, both with guidance around fiscal year 25 funds and fiscal year 26 funding, my goodness. With this, we should see the FY 24 grant agreements start to be processed quite soon. I believe March is the deadline for Q1 grants. Our Continuum has a handful of Q1 grants, largely held by King County. The other kind of bigger things within this appropriations is in relation to FY 26. A floor was set on how low the annual renewal demand in Tier 1, which is the more guaranteed renewal for CoC funding, can be set. So Tier 1 can be no less than 60% of the annual renewal demand. This is the total amount that we renew from HUD. Our annual renewal demand in FY25 was at 65 million. So unlike what was published in FY25, with a tier 1 of 30%, Congress is indicating to HUD that that tier 1 cannot fall below 60%. This is better news than what we saw in fiscal year 25. We'll see if HUD is as conservative as they can be with the 60%, or whether or not they will follow kind of precedent of what we've seen with not dropping below 85%. Additionally, there was some guidance in the appropriations to HUD that the NOFO needs to be released by June of 2026 and to have awards by December of 2026. These deadlines have been set in appropriations before, not always followed. HUD is one of their arguments with the lawsuits that were happening was that HUD is always late. So we will see if the June 1st deadline happens, or whether or not it does come in July like we typically see, and whether there will be the awards again by December of 2026. The HUD office, local office is back up and running as of today. They have been told to also be prioritizing the FY25 grant agreements. So we hopefully should be seeing those coming over the next few weeks to months. Questions?
Do I hear any questions for Kelsey?
Kelsey,
Jaja?
hi, Kelsey, can you tell me about so with the expansion of the board and the NOFO, does it have that same wording in there for the 4 points on NOFO?
We will not know entirely until the FY26 NOFO is released. We and other COCs are planning accordingly that will be there. The issues that were really raised with a lot of the court cases were around the processes by which HUD was wanting to enact changes in a new NOFO, not necessarily the content of the NOFO. As things move for FY26, we'll see what is to come. I imagine there will be some concerted efforts to ensure that there are not harms that are created to communities and to CoC programs that are operating. How CoCs are evaluated, I would follow decently what we saw in FY25, what was under the merit review for CoCs and the collaborative application. I foresee many of those being in there, particularly around structure, governance, and system performance.
And is that what the merit review is the structure and governance and system performance?
Yes, it's reviewing what is called the collaborative application. That is the larger narrative application that collaborative applicants have to submit with the priority list, talking about how the CoC is performing, structured, partnerships, etc. So that's the larger application. And that review is called HUD has renamed it a merit review.
Okay, so basically the wording for the 4 points that we're talking about is not in the NOFO that we're doing now. Is that what I'm saying?
This is a renewal, that's correct.
Yeah.
Yeah, so this is the continuation of the NOFO we did.
Okay, so the continuation of NOFO we did, didn't they just already award us the 24-25?
No.
No, I thought that was the upset was.
It's been a roller coaster. Yes. So there was a NOFO published in November that was then rescinded under court order. Under court order, HUD was mandated to begin processing renewals. What we have done in terms of informing HUD is around the processing of renewals. That court case is still not settled. Should it be settled in HUD's favor, HUD has maintained the right to go back and issue a 25 NOFO. With this T-HUD appropriations, that ties their hands to reissue anything for 2025. Because of that and the court case around FY25, we and many COCs across the country are anticipating what we are seeing in 2025 to be published in June for fiscal year 26.
I thought we were saying.
Okay, got you. Wow.
Yep, and I do want to clarify that in the program rule, a lot of the clauses that you will, like, one of the clauses is that, you know, and whatever HUD implements into their, you know, like what, because the regulations also include and whatever HUD wants to say. And so, you know, it is kind of a catch-22 in that sense, where regardless of who HUD is, they can implement their own kind of not restrictions, but regulations in accordance with their own law, I guess. And so that, yeah, hopefully that helps add to the conversation.
Yes. Thank you. Thank you, Kelsey. Oh, I'm sorry. I'm Jaja. I didn't say that.
It's okay. We forgive you. Does that mean I'm HUD? Because I'm always late too. Like, I feel like, I don't know, is that bad? I'm just kidding. Is there any other questions for Kelsey on this topic of the NOFO? Yeah, anybody? All right. Well, I mean, I think we all have a ton of questions, but we'll have to wait and see what happens with the court cases and everything. So, thank you for that, Kelsey. And I just wanted to clarify as well, the reason that we're not approving this is because we already approved it during the 2024 process, when we approved our priority listing and our application to HUD originally before the transition of the administration. Very confusing. I hope that, I know it seems to be confusing, but if anybody has any questions, please submit them from the public at coc.questions@kcrha.org, and we can answer anything that we have answers to. I think the next thing we're moving on to, we're making good time, guys, is the board applicant recommendations from the selection committee, which I believe is going to be handled by Victor and Kelsey on slides.
Yes, my name is Victor Lu. And for this work context, I use he, him, his pronouns, CoC board member, liaison to the charter revision work group, as well as a member of the selection committee. And Kelsey is going to assist me with the PowerPoint as we go along. So as you know that we form a selection committee to actually review and then essentially make recommendation on the final board candidates. As we go through the slides, I'll provide more information. Next slide, please. So essentially, I'm going to go through the selection process and what is the selection committee role. So there are 5 members on the selection committee, and it's time limited. It is an ad hoc committee to develop recommendation for the sitting of the new board members on the Continuum of Care board. There are 5 of us, as I noted earlier, on the board. So Dawson, Christina, Tamara, Jaja, and myself are on it. I do want to reiterate that for this composition on the selection committee, KCRHA staff is not part of the committee, but they are just there to provide, I shouldn't say just there, they are there to provide administrative support. They are there to provide administrative support. So essentially, it is the 5 of us that make the determination, the review, and the recommendation. And 5 members also completed the implicit bias orientation, which was a video. I believe in transparent communication. So I do want to share that the implicit bias orientation video couldn't play successfully during our meeting, but we got the link and we watched the video. Cool. Next slide, please. Okay, so this is the application criteria and scoring. So you will note that there is a board, this is how we review and score the application. One thing that I do want to reiterate that when we receive the application for review, at least two of us review two applicants. Is it? No. At least that every applicant is reviewed by at least two reviewers. And we use this criteria to do the review process. So the board selection and eligibility, we have to make sure that they are eligible for the seat or the sector that they are going to be representing. If they are not eligible at all, they will get a 0. If 100% eligible, they will get a 10. And then the second criteria for question 1 and 3 is understanding of the CoC. So essentially, the applicants answer the questions around the question 1 and 3. And again, if they do not provide specific information, they can get a 0. The highest score they can get is a 5 if they articulate clearly their knowledge and skills related to the CoC. And then the skills and leadership, which is question 3. Same idea, same concept. If they do not indicate their leadership or skills in helping individuals that experience homelessness in our region, they get a 0. On the other hand, if they demonstrate that capacity and competency, they will score a 5. Next slide, please. Cool. So we continue. As we know that the CoC board, we really value the concept on the theory of change. So there's a questions that 2 and 4 that really focus on the theory of change. Applicants have to submit responses of their understanding of the theory of change. Again, if they do not demonstrate thorough understanding, they get a 0. And if they have they demonstrate a very competent, thorough understanding of theory of change and also can provide specific examples of their impact on the impact on their leadership, they will get a 5. And then I believe this is the final one, overall candidate quality. And we have the opportunity to then make some notes and make some recommendation on whether we recommend these candidates or not. On a few things, right? So we need to understand whether the applicant did not provide any clear or specific responses or did not fully answer question, then will not recommend this individual. But I also noted earlier that the first process is really the eligibility. So if they are not eligible, we will not review it. They will not be recommended to move forward at all. And then applicant provided some thorough and thoughtful responses, but lacked specificity. Then overall the application was acceptable, but because of that, we will not recommend the applicant. And then finally is that very thorough, very thoughtful, answer all the questions, clear and specific responses, indicate very good and outstanding level of connection to the community. They bring the skills, they bring network, they bring the expertise, they bring the experience and enthusiasm of the representation of their leadership for the board. Then collectively, we will recommend the candidates to the applicant to move forward to the recommendation. And I do want to also reiterate that the selection committee, we actually use a consensus model decision-making process. So it's a consensus decision model making process. And I may have already mentioned it earlier. When we receive the application, the personal identifier information about applicant is actually blackout. So we actually do not know who is the person. So that really provide us with a more, I want to say, a fair and equitable review process, because I may know so-and-so if I see the name, or somebody may know so-and-so or their position. So we actually do not have any personal identifying information from the applicant beyond the way they answer the questions for eligibility and the questions in the scoring and rating criteria. Next slide, please. Cool. So the process, I already mentioned this already, that all the names and contact information are not provided. Provide us with unbiased reviews. Process of review are based on merit and experiences, skills, and leadership. Each application, which I had also mentioned earlier, was reviewed by at least two of us. And I also noted that we use a consensus model decision-making process to make the final nominees that will be voted on in the convening next week. Next slide, please. Cool. So 17 people applied for the CoC board seats, 3 for the elected public official seats, and there are 3 seats available. 3 applicants applied for the law enforcement seats, and there are 2 seats that are available. 11 for the business community seats, and 1 seat is available. And I also want to note that in the application itself, we actually noted that if they are a nonprofit organization, they will not be considered a they will not be eligible for the business community seat, because we do have a few applicants that are actually from the nonprofit sector, and we're specifically looking for a business community seats. 9 were determined to be seat eligible. Among the 17, they met the requirement representing local public officials, law enforcement, and or the business community. 8 out of the 9 seat eligible application met the 60% threshold on the application. So the selection committee also agreed that because we have a matrix and we tabulate the scoring, and then Kelsey works her magic, so we know who actually made a minimum expectation of 60%, because we have to have some expectation here. So if they meet a 60% point threshold, we'll move them forward. And again, 8 out of the 9 met the 60% point threshold, and those 8 individuals will be brought forward as the final nominees for the CoC membership to vote on. Next slide, please. Drum roll moment, just kidding. So these are the final nominees that we will be voting on at the CoC convening next week through the CoC membership. So the elected officials here, that you can see the names of the individuals here. I'm not going to try to pronounce all their last name in case I slaughter them, but I'll pronounce their first name. So for the elected officials seats, we have Valerie and then Rocco. Law enforcement seats, we have David and John. Business community seats, we have Scott, Michael, Lisa, and Jan. I will reiterate again that for the elected official seats, we are seeking 3 seats to be filled, but there are only 2 that are the final nominees. For the law enforcement seats, we are looking to fill 2, and there are 2 that are being nominated. For the business community seat, we are only looking to fill 1 of them. And also, during the voting process, I think there's a slide that talks about the voting process. Even though there may be 2 eligible seats for the law enforcement, we recommend 2. It's still up to the CoC membership to determine who to move forward. It may be both of them, or it may be none of them, or it may be 1 of them. Next slide, please. Cool. So what is the next step? So application for each final candidate posted online, and I talked about the CoC convening several times during this presentation. So it is February 11, which is, I believe it's a Wednesday, right? Yes, I can do math. It's a Wednesday. It's next Wednesday between 10 a.m. to noon. And earlier on the chat, I posted the link for the Zoom registration for the hosts and panelists. So if you have not registered yet, please register. Again, this information is also posted online on KCRHA website. People do need to register on the Zoom. It's a virtual meeting. So CoC membership during this convening will hear from all the final nominees, the candidates, either directly from the candidate or via a submitted statement if they're not able to attend virtually. And voting will open on the same day, on February 11, and be open for 30 minutes. And the votes will be reviewed and reconciled by February 17th. And the plan is the new members will be onboarded and join the March 4th meeting. I believe this is the last slide. Is it?
It is.
Kelsey? Yes, perfect. I think we can close the slide now. Now I'm going to defer to my selection committee members. I'll call out Jaja first because she agrees that she will provide more information if needed. But then if there are any other members that want to provide additional information, please proceed. Thank you.
Thank you, Victor. This is Jaja, and I have no additional information. You did a very thorough job. Thank you. I was just gonna talk about redacting the names, but you covered that too. So there's nothing more for me to say. Thank you. I appreciate you. But Kelsey, could you put that last slide back up for a minute, please?
They'll be sent out.
Oh, never mind. Catherine said they'll be sent out.
Yeah, thanks for
Tamara.
that. Oh, sorry. Thank you for calling on camera. Appreciate that.
Oh, thank you. Yeah, the one thing I would say is that the implicit bias training needs more human interaction and needs a lot more attention in detail. Because I don't want to gloss over it, and this is something that's worthy of a conversation, especially as it intersects with equity and things that like are critical for our community values. I just want to make sure that the information that's being transmitted to the people who are rating and ranking and reviewing all have like the same language and understanding of what they're like deciding on. And that the conversation around implicit bias, I think could take all day, but like I think it deserves more attention than simply showing a video. That's all I'm going to say. Thank you.
Thank you so much, Deborah, for that feedback. I'm sure KCRHA is noting down this information. And also we want to make sure that during the convening next week that some of us will join a little bit early to make sure that the video can actually play because it didn't during our meeting. So we'll definitely do the tech check prior. But thank you so much for that feedback. And I also think that in any process, we are seeking refinement, right? Not perfection. We can always continue to improve, but I'm sure that feedback is noted by KCRHA staff. Cool. Any other questions or any other feedback from my fellow selection committee members?
I just would always encourage COC members to, you know, make an educated decision based off of what the person is, what the applicant is committed to, you know, like I want to make sure that we're just looking at the person as a person and not as a title. And other than that, though, I don't see any other, oh, Tamara, do I see another hand?
Yeah, sorry. A very kind rebuttal, but just that I don't think it's necessarily the individual, but it's the institution that individual represents. When there is conflict or when there's a large decision, and I'm not going to go down that rabbit hole, I promise you. But I just want to like bring that to people's awareness that like I think being on the board is an honor, and we should be doing like vetting and screening and getting to know the candidates. And I love this idea that we're having a forum, but I also want us to remember like the history of colonization and how some of these systems and institutions were founded upon inequity and structural barriers. So, yes, I absolutely 1000% agree with you, but I just want to provide that additional context so that we're always basing our decisions on community roots and community wisdom.
That's what, yeah, you said it better than I did. I just meant, you know, making sure that we're vetting the situation well. So I've already started mine. Is there anything else on the, for the better, or for the good of the, what is it, thing?
Good of the order.
Good of the order. I knew it. Is there anything left on, for the good of the order, or can we?
No, I motion we adjourn.
Whoa, whoa, whoa. Whoa, whoa, whoa. I was gonna say, we got our next meeting coming up on March 4th, 2026 from 2 to 4 p.m. But we also have the COC convening to listen to the candidates and do our vote on Wednesday, the 11th from 10 a.m. to 12 p.m. And looking forward to that. Is there anything else, Catherine, I'm missing?
The candidates are posted on the website.
Candidates are posted on the website. And you know, some of them do have forward-facing positions there, so you know, you can look them up, right? You want it? I'm doing it. All right. Great. Dorsal?
Not to put Catherine on the spot, but I realized I didn't mention it in the co-chair's report update, but I did want to shout out Catherine that she has been doing work to establish the retreat. And it sounds like that is still in motion, and we will finally get a Robert's Rules of Order training, which the intent is not to establish Robert's rules. It is merely to empower the full board to utilize the tools available to it. But the retreat is coming, and just wanted to say that publicly.
Yeah, we've got a lot planned for that retreat on the community aspect too. It's really gonna be centered around building, right? So just, yeah.
And I believe there will be a talent show at the retreat as we agree.
Tamara?
Oh,
Did you wanna go-
yes, I just want to thank the co-chairs because I know I've been giving you guys a hard time about this retreat, having the Talanoa, like getting real with each other. And I'm so grateful for you for the continued advocacy and the patience, enduring patience with people like me. So I love you guys. And yes, let's rock this. I think we're a beautiful team, and I can't wait to meet the next family, like the next generation. Oh, yeah.
That's right. Thank you, Tamara. We appreciate you too. The fire and the passion is why we are all here, and I love that. So cool. All right, now, Josh.
Okay, I motion to adjourn this meeting.
Do I hear a second? No, I'm just kidding. Thank you, guys. We'll see you next time.
Thank you. Thank you.
Bye.
We're doing a talent show.